The Arizona Reproductive Medical Specialist has been helping families on their journey of having children. I had the chance to visit with Dr. Moffitt to learn more of what they do. Well, usually Dr. Moffitt is in my office as we talk about, of course, reproductive, but we're now here in your office, and let's tell people a little about ARMS.
Sure. So Arizona Reproductive Medicine is sort of a full-service infertility clinic, and we help people have babies. One of the big things we do is in vitro fertilization, and a lot of the magic happens in an embryology lab. So we're inside our embryology lab today.
Yeah, this is amazing to see, and what I like is that we're showing people this because there are people out there that are having challenges having children or want to know a little bit more about what you do. So let's go through what happens here at the clinic.
Well, a lot of things happen, but what we wanted to talk about today is something called pre-implantation genetic testing, and that's where we test an embryo to see if it's chromosomally normal. People don't realize it, but anywhere from 35 to 90% of the embryos a person makes are abnormal. So abnormal they would never establish, a life. And so because that's such a high percentage, we can test the embryo ahead of time and only put back a normal one.
Yeah, and that's very important there. We're seeing, of course, a machine here. Even though we're in the office, nothing's going on, we're here. But tell me a little about what she's doing here.
Sure. So this is Marissa. She's one of our expert embryologists, and this is called a micromanipulator. So obviously we can't actually touch or hold an embryo or sperm, but using this robotic system we can actually manipulate an embryo. So this is what we need to do to biopsy an embryo, to take a few cells from that embryo so that we can send it to a genetics lab. So this is how we do it, through this machine.
Wow, this is amazing. So, and after all that happens, where does it go next? You just said to a lab. What happens there?
Right. So what we do is we freeze the embryo, and that stays here, but the cells that we biopsy go off to a genetics lab, and they do some sophisticated genetics so they can tell us if the embryo is chromosomally normal or not.
So, and for people that come in here, I know they're a little worried, does it hurt? Does it, is it scary? Tell them a little about that.
Well, as far as the patient, we make sure they're comfortable. We have anesthesiologists that give them anesthesia, so they're asleep and comfortable during the process. The embryo, we want to treat the embryo well too, so we are very, very careful about making a hole which is the appropriate size and only removing a few cells. And we remove the cells that are the placenta part of an embryo, not the part that ultimately is the baby, so we can stay completely away from that.
Doctor, let's remind people why this is so important to a lot of people who are looking to have children.
Well, a big part of it is that as a woman ages, she has a greater probability of having an embryo that's abnormal. And people want to avoid putting back an abnormal embryo so that they can get pregnant faster, so they don't have a miscarriage, those types of things. And so we can help them by doing that.
Wow, it's amazing. And seeing this in person is incredible. I'm so glad I got to come to your office.
A lot of fun.
Let people know where they can find out more about ARMS.
Sure. So our website is arizonafertility.com. Pretty simple, arizonafertility.com, and all the information's there.
There it is. Well, Doctor, thank you very much for having us in here.